Hello, my name is Crystal Rubio, and today I'll be talking to you guys about vascular imaging and the equipment used, and how important it is in today's medical world. In today's world, we are fortunate to say the least that we have vascular imaging for diagnostic purposes. From non invasive to minimally invasive, vascular imaging is used today to assist physicians to diagnose or treat a medical condition in our circulatory system, including the arteries and blood vessels. According to Gooding in 1999, in 1953, the Seldinger's method was accepted to enter an artery primarily using conventional radiology as a form of diagnostic purposes through this method. This was the sole view once of an angiographer, a safe way to enter the patient's skin with a needle and no need to cut this area for observation of a blood vessel. Dr. Seldinger was a radiologist who invented the Seldinger technique and did multiple studies in which resulted in people being allergic to the contrast media, and even one death occurred. The studies allowed the technique to advance in what today is known as a branch in radiology, as interventional radiology. Interventional procedures. The benefit outweighs the harm caused by using vascular imaging in today's world, meaning if the risk the patient is taking will be more beneficial than it will help save their life. Radiation is needed to acquire the images required for diagnosing diseases or help in treating these diseases, but without it, it can be life-threatening. Although different environments are used for different modalities in vascular imaging, the concept remains the same. Interventional radiology is a branch that utilizes conventional X-ray, fluoroscopy, ultrasound, CT, and MRI, and relies on these modalities for internal imaging and their equipment. An interventional procedure will allow the radiologist to use their expertise in reading medical images that were utilized with these types of equipment, or guide them through a procedure that includes inserting them with a catheter using a guide wire. A very common interventional procedure is an angiography that uses an X-ray of the arteries and veins, which may identify, for example, a blockage in the arteries, using a catheter. The catheter, once injected into the blood vessel and injecting contrast into the patient during the procedure, will allow the artery or the vein to be seen on a radiograph. Vascular ultrasound is widely used and differs from those procedures using catheters by its not being non-invasive. The advantage of this modality is that it's less expensive, uses sound waves instead of ionization radiation, and accurate to identify the blood flow through the veins and arteries. Seldinger first introduced the world with his ability to demonstrate arterial access through the patient's skin in 1953. To start this procedure, you would need to find access to the blood vessel, usually done by feeling the patient's pulse, and this will determine the puncture site of the needle. Starting preparation and slowly allowing guide wire to follow through. Once stabilized, you would remove needle along with cap of guide wire and then replace with a catheter. The most ulterior access point used for this kind of procedure is in the leg to access the femoral artery. This is usually because of the size and it is closest to the surface of the skin. The guide wire guides the operator of the procedure once the wall of the blood vessel has been entered with a needle, or simply to exchange the wire with a different device. For example, the catheter will travel easily to the same point because of the guide wire. A type of guide wire will assist in guiding through the blood vessel called a maneuver wire, allowing to arrive to their target. Different guide wires are used are access and rail wires. Important note is that the guide wires need to be the same size as the catheters and hole. If too small or big, it can cause trauma to the blood vessel. At all times, it is important to secure the guide wire so it doesn't go farther along than needed and damage is prevented. The catheter is placed over the guide wire when positioned and withdrawn from outside of the body. The safety of placing a catheter over a guide wire can prevent damage to the vascular system by allowing the catheter to follow the guide wire, being used without a struggle and no trauma being caused. Catheters in the field of vascular imaging allows injection of contrast media. This will give the physician a clear image of blood vessels being examined and identify any disease, for example, in an aneurysm or plaque in the arteries. It is very important to take patient history when performing an invasive procedure. Taking down any allergies will assist in which type of contrast media will be used. A person allergic to shellfish may be allergic to the iodine, which includes shellfish as part of the ingredients. Procedures in interventional radiology use contrast media to obtain clear images inside the body of the vascular system, allowing to differentiate between tissues and the vascular system with contrast media, which is radio-opaque. Vascular ultrasound doesn't require any radiation to the body, but they do use a contrast agent known as an echo-enhancing agent, which increases the echogenicity of blood, allowing the tissue to be differentiated. A non-invasive procedure using iodine as a contrast media in CT, which is injected through the patient's IV. Iodinated contrast media is used for interventional procedures, and gadolinium-based contrast media is used as an alternative of iodine, if not available to be used. For these interventional procedures, it is important to use and practice aseptic technique and be prepared before beginning any procedure to prevent any errors. Advantages of these different procedures are that they can be done on an outpatient basis, bedside, and if required to stay overnight, hospital stay can be only 1 to 3 days. It is important to practice the sterile technique if not being done inside the operating room, which surgical asepsis is used before, during, and after surgery. Aseptic technique is used to decrease the chance of transmitting any infection from patient to staff or staff to patients. During fluoroscopy, it is important to consider the distance of the patient while setting up from the image receptor to decrease any scatter that can reach the operator of the procedure. This technique can be known as the air gap, and decreasing the air gap means there will be less distance for the x-rays to scatter after going through the patient. By not doing so, the automatic brightness control will increase technical factors like MA and KBP in order for an image to come out with good quality. This procedure allows a physician to analyze the arteries in almost every part of the body that's needed to allow visualization of blood flow or blockages. The catheter that is used during the procedure will assist the doctor to treat any blockage they may find or insert medication for clots. Dye or contrast media is injected after the catheter is placed, and then images can be taken using x-ray. Some may say that vessel damage, a stroke, and sometimes a heart attack are risks but have very low chances of occurring. Physicians analyze every consideration before sending a patient for this type of procedure and think if the good outweigh the bad. If benefits outweigh the risk, then they will consider the procedure for their patient. DSA uses a special software to visualize vessels that cannot be seen as clear and only when a scout image is taken, which is before injection of the contrast. Then, during the injection of contrast, the software then subtracts the scout images from the images taken with contrast, allowing to see just the opacified vessels without anything surrounding them. The difference with digital subtraction angiography and a regular angiogram is that DSA is used with fluoroscopy to assist in visualizing the blood vessels on a bony surface, or more of a dense type of tissue. This procedure has proven to obtain images of blood vessels without or subtracting the bone digitally for clear visualization of the blood vessel. Images that are obtained are without any overlapping shadows that can interfere with the reading of these images. In conclusion, vascular imaging has grown to be an important branch of radiology to obtain images to assist in diagnosing or targeting a specific disease for therapy. The different modalities are proof that evolution in vascular imaging is still yet growing to make it a safer way of performing interventional procedures for the patient and staff members themselves. The advantage of using radiology and different equipment for diagnostic purposes are great assets to the patient to consider before choosing to obtain these images. Although the patient may not know or have heard about these procedures, it is our job as a medical professional to provide them with knowledge in how an invasive or non invasive procedure may help save their life.